One of the mainstays of the ASH annual meeting is the scientific program, where hematologists highlight the latest discoveries in the field. In this joint session from the ASH Scientific Committees on Bone Marrow Failure and Blood Disorders in Childhood, speakers highlighted the latest discoveries. This includes the genetics of Fanconi anemia and the mechanisms of DNA repair that fails in the disease, as well as novel mechanisms through which interferons contribute to bone marrow failure and aplastic anemia.
It was a very exciting session because we learned about different pathways that lead to bone marrow failure. For example, defects in DNA repair using the Fanconi anemia model. We learned about the roles of inflammation and particularly macrophages in the context of infection leading to marrow failure. We learned some very exciting new information about the genes SAMD9 and SAMD9L that normally function to repress hematopoiesis and how they can be mutated in patients. And then lastly, to wrap it up, we looked at aging and hematopoietic stem cells and how that can lead to marrow failure. So overall, very exciting.
I think they did a great job sort of dissecting very specific genes and mechanisms that lead to bone marrow failure, which is a very rare condition, especially in pediatrics, but is important to understand so we understand more about hematopoiesis and developing new therapies for patients.
This special scientific symposium addressed the topic of drugging the undruggable, specifically in regards to hematologic malignancies. For patients who lack an immediately druggable cancer-associated genetic alteration, there are cutting-edge genomic and chemistry-based approaches that can address the challenges of this next phase of molecularly informed cancer therapy.
We started with a talk from Dr. Solid that focused on remarkable responses in the context of precision medicine efforts at Memorial Sloan Kettering. And then my talk focused on the idea of using genome-scale CRISPR-Cas9 screening to find new therapeutic targets in acute myeloid leukemia. And specifically, we highlight a new target called SIK3 or SIK3. And then Dr. Craig Cruz from Yale University closed the program and focused on a very exciting approach in chemistry, which is the use of degraders or PROTACs to target transcription factors, fusion oncoproteins, and other difficult targets.
This special scientific symposium discussed hematology's use of machine learning, which is a component of artificial intelligence by which computer systems analyze and interpret complex data sets to predict outcomes. The algorithms can provide critical prognostic data, optimize precision medicine approaches, and improve accuracy and efficiency of pathologic diagnosis.
The machines, they address problems where, humans have issues, and I think really the future is the humans and the machines working together. We're looking at, generalization to other labs as well. That's a big problem. I think, if we want to have something that really works well, it can't work just at, Emory or Northwestern. It has to work at other places too.